we had the radial nerve. I'm Catherine.
I'm Maddie.
I'm Michael.
And I'm Joe, holding the camera.
Okay, first we'll start with the pathway of the radial nerve, which is depicted in this picture. First, it comes off the posterior cord of the brachial plexus and then moves on to the radial groove of the posterior side of the humerus. Then it travels around the lateral epicondyle of the humerus, down along the medial portion of the posterior forearm, and then at the end it divides into deep branches that become the posterior interosseous nerve and the superficial branch that innervates the dorsal portion of the hand.
All right, so like what we were talking about with the pathway, about how the nerve is running, it's easier to see. We put these pipe cleaners on Catherine to kind of show you how it runs through the arm. So it's hard to see on this side, but it's actually going to come almost like under your axilla, under that armpit area, and come out posterior side of your humerus. And it's going to run like right with your tricep, so it's almost like right in between the heads of your tricep. From there, it's going to wrap around, go through like your lateral epicondyle of that humerus and wrap to that posterior side of your forearm, and that's where it's going to innervate all those extensors through that forearm, and then all the way to that 3.5 lateral digits of your hand. So that will give you all that sensory information through the posterior side of that forearm and hand.
There's also 4 branches that come off of this nerve that innervate the cutaneous area of the forearm, so the skin, and sends sensory information to the brain. The first is the branches off into the lateral aspect of the upper arm below the deltoid. The second branches into the posterior surface of the upper arm. The third into the middle of the posterior forearm, and the fourth branches to the dorsal surface of the lateral 3.5 digits.
All right, so the first one is the lower lateral cutaneous nerve. This one innervates the lateral aspect of the arm inferior to the insertion of the deltoid, so just over here.
And it's depicted in this picture in green, which you can see in that black circle.
The next one is the posterior cutaneous nerve of the arm. This one innervates the posterior surface of the arm, so up here on the back. Once again, you can see it's circled. This is the posterior side of the arm on this side. Next one we have is the posterior cutaneous nerve of the forearm. This one innervates a strip of the skin down the middle of the posterior forearm, so back here, also depicted in the yellow. And then the last one is the superficial branch. This one is the terminal division of the radial nerve. It innervates the dorsal surface of the lateral 3.5 digits and the associated areas on the back of the hand, so right over here, and depicted in the red.
All right, so the radial nerve innervates a lot of muscles on the posterior side of your arm and forearm. So this would include the lateral long and medial head of the triceps brachii, the peconeus, the brachioradialis, the extensor carpi radialis longus, the extensor carpi radialis brevis, the supinator, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris, and then includes a few additional muscles such as the extensor pollicis longus, the extensor pollicis brevis, the extensor indicis, and the adductor pollicis longus.
Cool. So most common injuries to the radial nerve. So we have 3 different pictures showing kind of different ways that you can actually injure that nerve. So first one is dislocation. So as you can see, when the humerus dislocates out of that glenoid fossa, the radial nerve actually runs kind of underneath that humeral head. So when it's pulling down, it might actually pull on that radial nerve, causing some damage there. Second one that you have is a fracture at the proximal humerus. Honestly, you could have a fracture up high, or you could be more in the middle of the shaft. Depending on where that fracture occurs, you can sever that nerve, cut it, injure it. So that would be your second one that it would be at risk for. And then third one would be compression of the nerve. So since the nerve runs kind of through your axilla, underneath your armpit area, if someone has crutches that might be too high, or if they're using the crutches poorly, that could compress on that nerve in that armpit area. So with the injury of that nerve, some of the structures that you'll see injured are a lot of those muscles that nerve is innervating. So motor function of those muscles, a lot of them are to extend that wrist up. So what you'll see a lot of times is you'll see that wrist actually drop down because you don't have that sensation through those muscles to tell your brain that you can lift that wrist up. You might also lose the sensation where you can't even feel some of those muscles. So like lateral side of the hand, you might actually lose some of that feeling in there.
And just to summarize what we talked about today, the radial nerve runs down the posterior side of the arm towards the humerus and forearm, and then innervates the extensors on the elbow, the wrist, and the fingers. It has 4 distinct branches that innervate various parts of the upper limb and provide sensory information all through that area. And then it's commonly injured from dislocations, fractures, compression injuries, and it can affect extensor muscles of the elbow and forearm, creating wrist drop and loss of function like Michael talked about.